this is Dr. Michael Shear with Learn LODI, a free resource for learning how to market, treatment plan, place, and maintain locator overdenture implants. The purpose of today's webinar is to describe an exciting new material from ZEST Anchors called Chairside. What we're going to be doing is we're going to be using this material to go ahead and attach 4 LODI implants to this complete denture. I'm going to set this aside for a moment just to describe this new material. So Chairside is a product from ZEST Anchors that is an attachment processing material that has been specifically formulated for locator. What's exciting about this product is that there is no primer required. So no messy varnishes, no smelly bonding agents, no extra steps. What's also pretty exciting about this material is the fact that it is a true dual cure material, meaning that it can self-polymerize or self-cure, or you can accelerate the curing with a light cure or a light curing unit. Now, when I say accelerate, I don't mean just like any of the other products on the market that are meant for picking up attachments. This is a true cured material, meaning that it has the properties of composite resin so that when the light hits it, it dramatically sets the material inside of the complete denture during pickup procedures. Additionally, it has preferred handling characteristics. It can bond to itself, and ultimately what's great is it has a shortened mixing tip for less waste and reduced material cost per case. It's also odorless and tasteless, and it has a low curing temperature for our patient comfort. So this is the processing box, or the product box that the Chairside material comes with. As you can see here, it's got some pictorial representations from the side and from the bottom that will assist you in utilizing this product. On one side, you can see here that it has everything that you would need to chart note appropriately for each patient treatment. It has the lot and reference number as well as the use by or the expiration date. On the flip side, you can see here it has a pictorial representation of what the Chairside product comes in each box. In each box, you get a syringe and plunger full of the Chairside material. You also get 15 angle tips and 15 mixing tips, or auto mixing tips. As we open up the packaging, we can see here that we have our 15 angle tips, as well as our Chairside product inside of our plunger and syringe. Our instruction manual, just in case we need to reference that, and our 15 auto mix tips. What you'll also notice on the inside of the box is this bright orange card, which just has a note on it that just says that you should express a small amount of this material prior to your first use to ensure proper mixing. And this is something that we'll do when we process our materials. As I set the box aside, you can see here that the Chairside material comes in this convenient dual mix or auto mix syringe tip. This has this plunger assembly for comfortable depression of the material into the denture. Also, what's pretty exciting about this product is the fact that it has this really short mixing tip and this really neat angle tip. As I mentioned before, what you'll notice absent from what you see in front of you is any sort of varnish or bonding agent. ZEST has specifically formulated this material for locator attachments to not need a varnish or a bonding agent. So this is pretty exciting because it helps minimize the amount of steps necessary and then ultimately shortens our Chairside time that we need to utilize to pick up our denture attachments properly. And I like that because the less time that the denture has to sit in the patient's mouth, the better. Especially during LODI procedures where we are at the end of a approximately hour and a half, 2-hour appointment where we are placing the LODI implants as well as connecting it immediately to the denture. So our patients can be tired, they can be sore, they can start the numbing process, start waking up. The last thing that we want to do is take extra time with steps that just are not necessary. And what's fantastic, again, about this product is that they've engineered this material, this denture processing material, to be faster and easier. And we're going to go ahead and describe those steps all in detail in just a moment. As we go ahead and remove the plunger assembly, as we mentioned before, we're going to be expressing a small amount of this material just onto a mixing pad just to clear out some of the processing as well as shipping, material that might have shifted along the way. And they recommend that just because, as I mentioned before, that when they manufacture and fill these syringes or when it's shipped to you, there can be some settling that occurs, and this just ensures that you get proper ratio mixing between the two materials. You have a notch that lines up on the front portion of this that's going to line up with the syringe tip, and it locks into place. Also, additionally, they'll package you these angled mixing tips with each one of the Chairside kits. And as I mentioned before, you get 15 of the angled and 15 of the straight mixing tips. And for my own personal preference, I find that the angled tip works especially well for filling in any sort of voids after pickup of the locator attachment for your LODI procedure. However, during initial placement of the Chairside pickup material, I prefer to leave the angled mixing tip off, and this is the perfect size to fill our recesses within our complete denture. So I'm going to set aside the Chairside product for now and describe what we're going to be doing. So we've reviewed previously the surgical technique for placement of LODI implants. As we see here just on our in-place model, we have 4 LODIs approximately in the first molar canine positions. Once the implants have been placed, we have also placed our locator attachments, and these are the 2.5 millimeter cuff heights. We've made a panoramic radiograph verifying that these are in the correct position as well as the abutments correctly inserted. And we can take our standard complete denture and fit it onto the existing alveolar ridge, just verifying where we are so far. If this is a flapless case, what we'll notice is that we have to create a recess inside of the denture to accommodate the locator attachment as well as the housing. So, distinctly different from where we might have been with the locator, the standard 2 implant locator video on the Learn Locator site, what we're going to do at this point is insert a Byte registration material such as Blue Moose or any of the materials that are available that are fast setting. And when we insert that onto the intaglio surface of the complete denture, you'll notice that I already have a few recesses already in place here. However, we're going to go through that demonstration so that way you can see. So when we express this material, we're going to be filling it all along the intaglio surface, just like you see here, and inserting it onto the patient's ridge where the LODI implants are. And this takes approximately 45 seconds to a minute to fully set, and what you'll notice is since I'm working on a benchtop model, it'll take a little bit longer. So we're going to take a break, and I'll be right back where we'll take over from there. So picking up where we left off previously, we have applied our Byte registration material on the intaglio surface of our complete denture and have allowed it to fully polymerize. I'm going to go ahead and remove our complete denture, and it can be somewhat difficult to remove, and we'll see that on the intaglio surface it'll allow us to visualize where we need to modify. So I'm going to go ahead and zoom in just for a moment. So that way it'll give you a better idea of where we're going to be modifying. And what's nice about this approach is that I don't need to use a pencil or any sort of marking media, but I can go ahead and take a number 8 round burr and start to insert little holes through the actual Byte registration material where I have denture show through. Now I've already created the recesses for the locator and the housing, or the denture cap, on this in-place model. However, on your patient demonstration you might notice that you will have denture show through. So I'm going to go ahead and demonstrate what I would do clinically. So I would take my number 8 round burr and just start grinding through our Byte registration material all the way around and clearing off with air. And we'll start to create a recess inside of that Byte registration material and carry on for the other side as well. And you won't hear any acrylic grinding noise because, again, I already have those recesses in place. Okay. So now the appearance of what you would normally see is the denture showing through just like you see right in here, and right in here, and right in here. So I'm going to go ahead and remove my Blue Moose or Byte registration material. And it can be somewhat tricky to remove. So with the help of a trusty number 7 spatula, we can start to clear it out. And now what you would normally see here is not these big relief holes, but what you would actually see is you would actually see a little couple of pinpoint marks where then you could mark on the integular surface of the denture exactly where you need to enlarge. Once you use the number 8 round burr, I typically like to use one of these inverted pear-shaped burrs, like you see here, to start to create my recesses. And I like to go ahead and start doing that at this point because I have marked a hole with my Byte Registration material and my number 8 round burr. Okay. Once I have created my initial holes, I can then clean off some of the excess, just like we see here. And I have some initial clearance holes like you see here. So at this point I'm going to take my in-place model, get it cleaned up here, and I'll be right back. Okay, so picking up where we have left off, my last step was to utilize the fast-acting Byte Registration material on the inside of the complete denture and to create some initial relief holes. I went ahead and I cleaned up my model just because it tends to be a little bit of a messy step. What you'll find is clinically it's not as messy as what you've seen here. My next step is to go ahead and then verify my implant insertion torque, and we can do that just with our LODI instrumentation and verify our torque, verify our torque, and verify our torque. Because now at this point we have verified that our implant position is compatible with the placement and prosthetic space for our LODI implants. So now we have reached at least 30 Newton centimeters for each one of our LODI implants. We feel comfortable in attaching our complete denture and making the attachment to the LODI implants an immediate load or fully loaded situation. So what we can do is then take the next step, which is attaching our block-out spacers or white O-ring spacers on top of our locator attachments, like you see here. Here. And what I'm trying to do is just very carefully position them right on top of our locator attachment, just below that little notch. Now let me zoom in just a little bit so you can see that a little bit better. As you see here. And I'll bring that up to your camera so you can see. That little O-ring spacer just fits very, very softly on top of the locator attachments. Because at this point I'm ready to insert my denture cap. The denture cap is going to come in at an angle, and you're going to seat it at an angular fashion. Try not to seat it straight up and down, or else it's going to run into some trouble. You might not be able to get it down as easily. So I always start from one angle, go to the other side. Same thing here, and then same thing here. Now I have my 4 LODI or locator denture caps with the block-out spacers. One thing you'll notice is that occasionally you might have a LODI implant with a larger gap down below here than you'd normally like to see. What you can do with these O-ring spacers is you can stack them. So I'm going to demonstrate that right now. I'll take a couple of them, and you can stack them on top of each other, just like so, and just like so. And now when you reinsert your LODI cap or your locator denture cap, it'll fit nicely on top of the LODI implant. So this is a great clinical technique because some practitioners will use an additional material like a block-out material, or they'll try to use wax or a rapid set PVS Byte Registration material. What's nice is ZEST has thought about this and they said, nope, it's pretty easy. Just take a couple of extra of the O-ring spacers, put them on top of each other, and you'll ensure that you don't have any undercuts to be concerned about. Now, some people will go ahead and try on one of the housings before they try on all 4. It can be a significant challenge to go from where we were before with the Blue Moose registration or the Rapid Set PVS to verifying that these are fitting down correctly. Because sometimes if you're contacting a little heavy on this one corner here, it might cause you to inadvertently open this recess up larger than you should be doing. So some clinicians feel more comfortable with putting on one spacer and one denture cap, verifying that I don't have any contact in here when trying it in the mouth, and then adding a second one, and so on and so on. For me personally, I've tried it both ways. It depends upon the patient, depends upon the clinical situation. I like to do it both ways. I'll just make a game time decision clinically based upon what I see. So at this point, I'm going to verify that I have my denture fitting down properly. Now again, this is an in-place model, so the recesses have already been checked. But you can see here, I've got a little minor denture rock and not as much on this side. What's important is that you might feel some more contact as you insert and remove your denture. Inserting and removing, inserting and removing. But what's important is that when the denture is fully adapted to the tissue or the alveolar ridge, that you don't have any binding effects. And that's ultimately the most important thing. As you have divergency or slight divergency between your locator or LODI implants, you'll notice that that divergency is going to have a slight acrylic metal contact every time you insert and remove the prosthesis. So when I insert, it's okay to have a little metal contact so long as you don't feel any in here. So the next step is to use a little bit more of a detailed procedure with the housings or the locator denture caps, verifying that you have clearance all the way around your complete denture. There's several ways to do this, and I've tried all of them, and I've had clinicians tell me various ways that they like to do it. Personally, there's two techniques that I find the simplest and the most fastidious approaches. Number one is to take just standard rope wax on the internal portion of those relief holes, like you see here. I'll probably need a little bit more for this one. And then seating my denture on top of my LODI attachment or the locator denture cap. Seating it fully into place and removing. And then, hey, we come attached with it. That normally won't happen in the mouth. But then it'll give you a recess inside of the mouth that you can see here or inside of the denture where you need to adjust. This technique is simple, efficient, and very inexpensive because you're just using wax. The tricky part is that this waxy portion tends to leave a little bit of a residue that if you don't have a steamer or any way to really clean the denture as well as the denture cap, it can be somewhat problematic. So unless you have a steamer in your office, I would be a little bit hesitant about using this technique. However, it's a very efficient and simple, easy way of doing it. So I'm going to go ahead and remove the wax at this point. Oh, pardon me. The next step is what you would do is you would take a blue pencil and then mark the areas where you see show through, just poking through different areas of the softness of the wax. And I can feel I don't really have any areas sticking through because again I've got a recess already created. So I'm going to very carefully remove some of this wax just with my trusty number 7 spatula. Just like we see here. And here's the tricky part. So as you can see, I've got my O-ring spacer picked up, and now my housing has quite a bit of wax in different areas. I'll have to take that to the steamer. So some other ways of checking to verify that we have clearance is, number one, you can use a fit checking paste material. And this is just like a fit checker that you would normally use for crown and bridge dentistry or implant dentistry. And this is my preferred way of doing it. What I like about it is that it's fast, efficient, cleans up really easily. It is a little bit more expensive, but ultimately you save more money in the long run because of efficiency. Some people like to take some occlusal indicating wax like you would normally use for checking occlusal adjustments, and they'll take off a little piece of this and apply it to the intaglio surface of the complete denture and then verify any areas where it's sticking through. This way also works very nicely. There's some clinicians that do like to use just standard articulating paper, and the articulating paper is applied to the internal surface of the denture, typically on the black side facing up, and then it goes into the mouth and it'll rub into different places, and then they can make a mark and adjustment. This is also an easy way of doing it, however, it can be very, very messy. An additional way of doing it is just to use a light-bodied PVS-like material, and this is a very simple way of doing it as well. However, it tends to come in different colors that can be a little bit more difficult to manage. I typically find that the fit checking material is the same type of material. If you keep it in a syringe type form, you can mix it on a pad and be very, very efficient with it. So all of those different ways work very, very well. I'm going to go ahead and go back to my laboratory, clean off some of this waxy-like material, and come back and then show you the verification step using the fit checking paste. So picking up where we have left off, last time what I did was I went ahead and I took some of that rope wax and put it on the inside of the denture, and since then I have cleaned up the denture as well as put my O-ring spacer back on and my locator denture cap. At this point, what we have done is already created some initial recesses from the Blue Moose or from the Rapid Set PVS material, and what I'm going to do is I'm going to use a fit checking paste now and verifying that I have enough room around my locator housings. So I'm going to take the paste material and mix them together, which unfortunately is a super small mixing pad for what I'd like to use. Taking my denture intaglio surface, I can apply a little bit to each one of the recesses. Like you see here, and insert that in the mouth on top of our denture caps with moderate yet light finger pressure on both sides. We don't necessarily want the patient biting down at this step. What we can do is just with the finger pressure hold it down, and then after about 20-30 seconds or so I can then put some cotton rolls on the occlusal surface of the complete denture and then have the patient lightly bite down. So we're going to give that a couple of minutes and come back and verify that the material has fully polymerized. This material typically clinically only takes about a minute and a half for it to set, but since I'm working on a benchtop, things can be a little bit more delayed. So we'll come back where we left off. Okay, so now the material has had a chance to fully polymerize, we can go ahead and very carefully tease this away from our model or from our patient. And what you'll notice is sometimes it does get stuck on the internal surface of the locator attachment and can remain in the patient's mouth, which is fairly typical. However, since we're working on a model, it'll give you a really good idea of how this would work clinically. So at this point, if it does get stuck in the mouth like this, which has occasionally happened to me, we can then verify by looking to see if I have any areas of show-through here of the denture cap. And if I don't, that typically means I've created a recess large enough for each one of the locator denture caps. Sometimes what you can do is very carefully tease this off and then reposition it back inside of the denture. Now, thankfully, most times, clinically, this won't occur. However, it will occur occasionally. But since we're working on a benchtop and on a model, this will happen almost every time. There we go. And then reapplying it to our complete denture. What you'll notice sometimes is the little O-ring spacer will come with it as well. Okay, and this is typically the appearance of what you would see chairside after you have placed your LODIs and done the fit checking material. We can go ahead and carefully remove our O-ring spacer, putting it back on our model or onto the locator attachment in the patient's mouth. There we go. Popping that back in there. And if I remember, I've got a couple of these to get worried about. Anyways, I'll address that in just a moment. What we want to do is we want to go ahead and verify that I don't see any sort of acrylic resin showing through this white fit checker. So I'm going to zoom in just a touch. So that way you have the opportunity to see what I'm looking at. What I like to do is I like to take a blue pencil and just kind of pat around areas of the fit checker. And what this will do is it'll verify that, number one, I'm feeling acrylic resin that's hard poking through that. And then number two, what will happen is that if I do feel something hard, it will mark blue. And I'm not really feeling anything hard, but I'm going to kind of stick through this one just to give you the idea of what it would look like. So at this point, I can remove this. And there we go. So what we would normally see clinically is a blue mark showing through just like that right there, and we could take an acrylic resin burr and modify that. And we'll do that at this point. We can use that same pear-shaped burr. Let me zoom out a little bit. Pear-shaped burr, and make the modification as necessary. And we have cleared that, as well as a little tiny spot right over in here, and clear that. And touching this one and touching this one, putting a little air to it. And then we can go in and just visually inspect how much clearance we have with my trusty number 7 spatula. Okay, getting rid of any sort of kind of little flaky-like materials. And now we have created sufficient room for our locator housing caps, our denture caps, as well as sufficient acrylic resin to retain that. So I'm going to set this aside just for a moment and recover my little O-ring spacers. So for demonstration purposes, I went ahead and I cleaned off my model a little bit more. Clinically in the mouth, we wouldn't have as much of this affecting us because benchtop wise is a little bit different. In the mouth, clinically, the step does go quite a bit faster, through experience, you'll find a rhythm that is compatible with you. Typically, it only takes just a few minutes to do these initial steps. However, I would always caution clinicians from not rushing the step, because while you could have 4 very nice placed LODI implants, typically only takes about an hour to do that procedure. Sometimes, if you rush the step, miss 1 or 2 steps, and then the pickup is not done properly, it can lead to further maintenance issues down the long term. So what I have right now is I have my 4 LODI implants with the 4 denture caps and various blockout spacers ready to go. At this point, I have verified clearance and relief inside of my complete denture, and I'm ready to begin the couple of modifications that I like to do with my complete denture to get it ready for pickup with the chairside material. So I'm going to set aside my model just for a moment. The first step is to go ahead and take an inverted cone acrylic burr, like you see right in here. And what's nice about this is that it will create a mechanical undercut to further assist in retention of our pickup material. As I mentioned before, ZEST has manufactured and designed this chairside product material to not need a varnish. However, they do recommend some additional mechanical retention undercuts to further assist in retaining the material. So I take an inverted cone on the mesial, distal, and lingual. I tend to shy away from putting inverted cone retention marks on the facial just because it can be a little bit thin. I'll rub along the inside portion of the relief holes, creating that mechanical undercut. And same thing in here. Cleaning off with a little bit of air. And at this point, I now have mechanical undercuts within my relief areas. The next step is to take a number 8 round burr again. And what I recommend is I recommend vent holes for our complete denture. Now, some clinicians at this point would feel very comfortable with filling material inside of these holes and seating the denture in place. Other clinicians will feel more comfortable with a large window on the lingual surface of the complete denture. Me personally, what I really like to see is a couple of vent holes just at the superior portion of this relief chamber and towards the lingual. If you somehow create a little bit of a facial hole, like we sometimes get like right in this area around the first molar, that is perfectly fine as long as you have an area for venting. Typically what happens is you have such an intimate fit of our complete denture with the locator housing cap. When you place material inside of here, up to 2/3 filled and seat it onto the arch or onto the implants, a hydraulic force ensues, and that hydraulic force will push material out onto the tissue supporting surface of the complete denture. And you'll a lot of times get a lot of flash material out in here, out in here, out in here, out in here. We recommend against that because flash material is not that big of a deal. However, if you get it a little bit thicker than is ideal, as you are trained to do, you'll remove some of the flash material. However, if there's a large amount of flash material present here, if I remove it after doing the pickup, what that's telling us is that the implant locator attachments are going to be locked into a certain orientation. The excess material that is flowed out was adapted to the tissue. However, when I pluck it away, now I've got a gap present within those areas. So we try to keep that to a minimum. It's okay to get a little bit of flash, but too much flash, I would recommend repicking up the attachments. To minimize the amount of flash, we put vent holes. So that way when the denture goes down on top of the implants onto the tissue, you have a venting effect, so that way hydraulic forces are minimized. And how we do that is we take a number 8 round burr, finding that superior portion of where the relief chamber is, and then angling towards the lingual. There we go. Now sometimes it might be a little bit more superior than that. I'll go ahead and remove that and then trace it back from the intaglio surface, just clearing that hole. Second step, we'll go to the next one. It should pop through a little bit easier. And carrying on. And then carrying on to the last one. So while doing that, now we can see from the occlusal or the cameo surface, you can see 4 vent holes. And I'm going to go ahead and take an instrument and then also touch it up with my number 8 round burr, so that way I've got a pretty clear vent hole. I try to minimize any sort of resin flash or acrylic resin that's inside of there, because that'll create some artificial flow forces that we would prefer to keep away. We like to keep this chamber as smooth as possible. Again, about the size of a number 8 round burr is sufficient. And then verifying that I have all the material missing from in here and cleaning it up with a little bit of air. And then also further cleaning things up just with the help of a number 7 spatula. And a little bit of air. Now as we see here, we have our completed denture recesses, including our lingual vent holes, to ensure that we keep our hydraulic forces to a minimum. Now some clinicians would prefer or shy away from doing this because they would be concerned that the patient would think that this is an aesthetic problem, or they would be unsatisfied with this because of these holes within their complete denture. And what I can tell you is from my personal experience, once I discuss with the patient the reason why we're doing this, they're perfectly okay with that. In fact, I've never had a patient ever complain about those aesthetic holes. Some clinicians, however, like to put in facial vent holes and then lingual vent holes and inject material from the facial towards the lingual while the denture is seated. And I can see, especially in maxillary cases, where this might be somewhat of an aesthetic challenge because you now have a pink hole in various places. However, this clinical technique does work very nicely, and it's up to your preference, the clinician's preference, which way you'd like to go. I've tried it all various different ways, having a lingual vent hole like you see here, a lingual larger access hole, a no access hole, no vent hole, and just feeling from the occlusal, and then also facial to lingual. And what I find is the simplest, easiest, and most predictable technique is this one that I'm showing you right here today, an adequate relief chamber in combination with these lingual vent holes. So now at this point, again, verifying that my denture is seating completely. I have no rocking motion. I have my lingual vent holes. I do not need a varnish layer with this material, like previously discussed. At this point, we are ready to go ahead and apply our chairside material into our recessed chambers. One thing I like to do, just because we're working on a model, but also one thing that works well in the patient is you take a little Vaseline or petroleum product and just paint it along areas on the outside portion of your complete denture, just in case you do get a little bit of resin flash. This will very easily flake away. And then the same thing here distally. And then I also like to do it lingually, trying to stay away from going inside of our relief holes. This just makes the cleanup process a whole heck of a lot easier. Now this is not something that I would do clinically. This is just for our model. We're going to take a little Vaseline, a little petroleum, and just apply it to our model so that way I don't get those to accidentally bond. Just like we see here. So So just to review the chairside material, we have our complete denture that's ready to attach our locator housings, denture caps, to our denture. Our chairside material has just the mixing tip on it. However, if you feel more preferable, you can attach the angled mixing tip at this point. What we'll find is the ZEST marking material does have you doing this on the technique guide. However, I've tried it clinically and I find it's a little bit easier to utilize the angled mixing tip to fill in voids after pickup procedure. I find it much easier to insert our chairside material into the recesses using just this mixing tip, because this mixing tip is a lot harder to fill that larger chamber and then also to stay efficient with your timing. So now I've attached my mixing tip, my plunger assembly is ready to go. My patient is relaxed. I try not to have them tense up their muscles or cheeks or anything like that, because when I insert the denture on top of the locator housings or the denture caps, I want to be holding the denture very gently. I try not to have the patient bite down, because what you'll find is that when the patient bites down, sometimes they bite down a little bit crooked, especially after a long LODI procedure. It's been about an hour, hour and a half of surgical procedures. The patient's numbing may or may not starting to be wearing off. The patient's saying, hey, I'm ready to go ahead and call it a day. Okay, let's get this denture done. So the patient will sometimes say, all right, I'm going to bite down, and they bite down a little bit crooked just because they've been leaning back in the chair for so long, or the anesthetic might be affecting the way that they feel that their occlusion is going to be happening. Sometimes it's also difficult to manipulate a patient into CR or CO, depending upon how long they've been in the chair. So what I recommend doing is just with a light finger pressure, just holding the denture into place, ensuring you've got maximum tissue adaptation of the complete denture, and then if there's an occlusal discrepancy after, adjusting and verifying that once the attachment has been completed. So at this point, I'm going to take my chairside material and I'm going to inject it until it's about 2/3 full within my recesses. So I'm going to take the chairside, injecting until it's about 2/3 full. Like you see there. This is about our ideal mix, what we'd like to see. It's a little bit more in one or two spots, then that's okay. We might have a little bit extra flash. As we insert onto the complete denture, onto the ridge, just a nice, gentle, easy motion. And we want to verify that we have material flowing out the linguals, like we see right in here. I'm going to keep light finger pressure and holding the denture in place for approximately 15 seconds or so. After about 15 seconds, I can then go ahead and utilize my light curing unit to accelerate the set of this material and the polymerization. At this point, we're ready to begin light curing. So what I like to do is I'll hold the patient from the rear, and I'm going to keep my thumbs on it just like so, holding my patient's chin just like this, and my thumbs on the denture. My dental assistant is going to come in from the front and start light curing each one of these. I recommend about a 20-second cure for each one of them. As you can see here, I don't have 3 sets of hands, so I can't demonstrate that, but you'll have to just trust me. So at this point, we fully light cured these, and we feel comfortable in removing these. So as you can see here, we're going to verify just with our fingers that everything feels tight, everything feels polymerized. We're going to carefully remove. Sometimes on a model, I need the help of my trusty number 7 spatula. And you can see here that we've picked up all 4 of the locator denture caps on the LODI implants. And what's nice is that I've also picked up our white O-ring spacers as well. One thing I've trained my dental assistants to do is that as soon as I remove that denture from the mouth after a pickup procedure, they sweep the mouth to verify that I have accounted for all of my white spacers, which I know I have done in my pickup because we're working here on the benchtop. At this point, we can then remove these little walkout spacers and evaluate if we have any extra flash of material around there, which I can see I've got a little bit right in here and a little bit right in here, but not too much. You can see it just very easily flaking off as I do that. Bring it up more to the camera. And again, you can see it just very easily flaking off. And this is within the zone of tolerance as well. You can see there's a thin amount of material just flaking off right in here, just with a simple explorer. So you can tell, just because of the video, I overfilled this one just a little bit, where the video demonstrating the Chairside pickup material on the Learn Locator channel, I was using just the right amount of material. There we go, just like so, and just like so. As you see here, I've got a little bit of extra material here and here. I can't see my black processing mail in place in here, but I'm going to go ahead and start clearing that out. One thing I also like to do is just take a discoid instrument and just flake off a little bit of this extra material. Should just very easily flake off. Very easily flake off. And very easily flake off, like you see there, like you see there. So I'm going to put a little air to that. And now we can start cleaning up our LODI implant overdenture. The first burr that I like to use, again, is my number 8 round burr. And I'm going to zoom in a little bit so you can all see that in a little bit more detail. I'm going to take my complete denture, holding my number 8 round burr, just adjusting until I start to hit just that little black attachment, the black processing nail. A little bit of air. And continuing on. So now over here, you can see that I have a little bit more resin flash over the top of this black processing nail. I'm going to just take my discoid instrument, see if I can just carefully flick that out of there. Sometimes if I switch to the cleoid side, it'll come out a little bit easier. If not, I'll go back in with my round burr. Okay, I'm just picking up my black caps, and now we're starting to look pretty good. Before I would go too much further, I'd like to go ahead and pop this back into the patient's mouth just to verify that the implants are solid. And as you can see here, I have very little motion or rocking. Everything's fitting really, really nice. Again, I'm going to demonstrate that again. I have our patient cleaning up a little bit of petroleum product. We're going to take our black processing pickups that we have just attached before I really do too much adjustment to it, popping back into the patient's mouth and just verifying that I have stability and stability. And the important thing is that I'd like to visualize that I don't have any sort of denture rocking motion. The black processing cap does not have this pivoting capability in it. As you can see here, the standard locator nylon insert has a feature that it will allow this denture cap to pivot and rotate on top of the attachment. As that's inserted and removed, you can see here the locator inserted. The nylon insert remains rigidly attached to the locator attachment, and this denture cap will pivot on top. The black processing componentry does not have that capability, so you should not see any sort of pivoting or rocking here. Once I've verified that everything is pretty much stable and I'm satisfied with the result, I can begin filling in any sort of voids at this point. I can pull out my Chairside pickup material and a new mixing tip. And I'm going to attach that just using the little notch to guide me. And at this point, I will pull out one of the angled mixing tips, or the angled tips. So what I really like about this product is how it handles, especially at this stage. So you can see I've got a little tiny void in this area right in here. Right in there, just a little tiny void. And then I have some void out in here that I'm going to simulate filling that in and filling this in up in here in various places for my LODI implant case. So now at this point, I'm going to take my plunger and I'm going to start applying in those areas with my angle tip. Just ever so lightly. What's nice about this product as well, it has an inherent bonding capability. It will bond to itself. So you don't need to do additional steps. You do not need etch or any sort of bonding agent. It will just bond directly to itself. Typically I don't need to use this little brush. However, for this case I will, just because I'm building it up along this surface right in here. But that little tiny void that I showed you before, I can just go ahead and take my angled mixing tip and just rotate it back and forth, just like you see there. And that will allow me to fill in that void very easily. Same thing along in here. And this is typically what I'll do clinically, just like you see there, and just like you see there. Again, what I was doing there was I was just inserting and just drawing this material up a little bit, just like that. And again, what's nice, light cure, no need to wait. I'll still give it about 20 seconds each just to ensure that once I start making adjustments to it, I don't have to worry about it being too soft. So at this point, I'm going to hit 3 of these at 20 seconds each because I didn't have to fill in on that 4th attachment. Okay, so once I've had full set time for each one of these, I can then go ahead and start polishing and adjusting those areas I just filled in. So since it was all freehand, it should just be a very simple procedures, touch up 1 or 2 of those areas, that little voided area. What I like to do a lot of times is if I use a lot more of those O-ring spacers like I did on this one over in here, I do sometimes have to create a little bit more path of draw as that goes into place. It's okay to make sure that you have that, not in the typical shape of what that ridge should look like there, but if you have just a cylindrical access, that's perfectly fine. A little bit of air. If I have a little bit of resin flash sticking out over the edge, I can use this little smaller pear-shaped burr, and this is something that I can just use along that alveolar ridge, just cleaning up any sort of areas where I might have had just a little bit of flash. Same thing in here, just giving some more rounded shape to it. So now here's our pre-polished stage on the intaglio surface where the black processing nails are. At this point, we're ready to go ahead and start trimming the surface over in here. How I like to do that is the use of 2 instruments. I like to use just a standard tapering acrylic burr in combination with one of these impregnated polishing points that'll cut and polish at the same time. So step 1 is to do our gross reduction with this burr. See here, I have a little bit extra flash on that one around where my lathe holes. Now typically what's nice about this product is if you did use a little bit of petroleum jelly, you'll notice that it should just flake right off, like that. There you go, and you'll notice a little bit better over here as I adjust this one spot. The rest should just flake right off. Fairly typical. Or not. That one bonds on there pretty well. So I'll just keep adjusting until it flakes off. It usually is when it gets thinner. There we go. So now what's interesting about that is this also is a great example of addressing some of the skeptics that might be out there. Some people might say, well, gosh, no, you need a varnish layer or you need a bonding agent for this material to work properly. You noticed here that I applied petroleum product all along here and along here and along here. These flaked off really easily. I also applied it right over in here. You could see here I had to keep grinding until it went all the way down to the denture base, all the way down here and down in here. And what I typically find is that these attachments, they hold in there exceptionally well. The patients that we've done this on so far have had 0 issues with them popping off. It's a very nice material, and the efficiency and speed and ease of being able to skip the varnish layer or the bonding agent is clearly superior. So at this point I can remove my tapering burr and apply my polishing pointed tip with the impregnated polisher and just touch up some of these areas. And running at a moderate speed. You don't need to be too fast, you don't need to be too slow, just a moderate speed. And same thing here on this last surface. And occasionally you'll have to fill this in just a little bit, but in this case it does not look like I will need to. Okay, clean it up with a little bit of air. Now we're looking pretty good. So this is the step that we have before we're ready to go ahead and polish just with a rag wheel. Let me zoom out just a little bit so you can see just a little bit better. Here we go. Now what I like to do is I like to take this to my rag wheel, finish all of my polishing procedures before I change out my black processing inserts with our final inserts. So we're going to take a break and I'll be right back when that's all done. Okay, so picking up where we have left off, I went ahead and I polished up some of the edges of the denture just with a rag wheel and pumice. I used medium pumice. You can also use coarse combined with flour, or you can use a variety of other polishing compounds. I find just straight up medium pumice is more than sufficient for my needs, and my patients are generally satisfied with that. At this point, we have our patient with our LODI implants already completed. The locator abutments have been torqued down. Everything has been done. We have attached our black processing housings to our complete denture, and now we're ready to begin changing out the black processing inserts to our final nylon inserts. At this point, for most LODI cases, I tend to prefer to use the red attachments because I find that it gives you sufficient retention but not too much retention. The light blue inserts do work, and I have used those on some cases, but what I tend to find is I favor the red attachment a little bit more. We can go ahead and take our core tool, turn everything down, and the core tool, when you unscrew it 2/3 of the way, this little plunger assembly will cause you to be able to insert this core tool directly into the black processing nail to remove it. So what you do is from a vertical orientation, you're going to push straight and pull straight until that attachment comes straight out. You can see here, as I screw it, this portion clockwise, this portion counterclockwise, it'll just pop right off easily into my fingers. And we're going to repeat that until we have removed all 4 of these. See here. And the last one, or pardon me, second to last. And the last one, pulled back out vertically. You can see here sometimes it pulls a little bit of jar, but perfectly fine, makes my job easier. Now I can unscrew completely, grab one of our red caps, put it just gently on top of this core tool. As you see here, there's no retentive feature, so if I hold it vertically it will fall out of my hands. So I very carefully am going to hold it upside down, and that's going to go directly into my locator housing cap until you hear a snap, just like so. And I'm going to repeat until I do that with all 4 of them. Same thing here. And it goes vertically until you see it drop. Occasionally it will drop, so just kind of fix it until you're straight down on top of it. And you should still hear a snap. If you don't hear the snap, that doesn't necessarily mean that you didn't do it correctly. It just might mean that you might have to readjust it and re-pop that housing back in. It just went in a little bit to the side. The pivoting nature of the locator housing is what allowed you to do that. Same thing here as I insert. And then same thing here. And the last one as I'm inserting. And now we have our 4 extended range light connections ready to be inserted on our LODI implant patient. We're going to go back to the mouth, and we want to verify that our LODI implant now has great stability. You might notice that there's a little bit of rocking motion. That's completely normal. You can have a little bit and a little bit. But typically you'll find really excellent stability here. That rocking motion that you're feeling right now is just the pivoting nature of this attachment allowing it to work. So that semi-resiliency that's built into the locator attachment is going to give you improved patient factors as well. So now at this point, we have polished up all of the areas on the outside portion of the denture, and verifying we have excellent retention. We can take our fingers and teach the patient how to insert and remove this prosthesis. As you can see, it can be somewhat of a challenge. And you want to hear that audible click as it pops down in. When we have 4 nicely spaced LODIs like we have right here, we really do have excellent retention and phenomenal stability. The last couple steps that I like to do is, again, verify occlusion. If you're off a little bit, you can adjust in the mouth. If you're off quite a bit, I would recommend a remount procedure. And generally it's not because you did this procedure incorrectly. You probably did this procedure correctly if you just held it with your fingers. The problem is that you might have had an occlusal discrepancy during your denture procedures that you just did not know about because the patient did not necessarily have the ability to really zero in with firm ability, such as what you would get with the LODI implant case. So now at this point, again, just verifying retention, I can then take my fingers back and forth, side to side, verify that we have stability inside the mouth. Typically what I like to do is just have the patient chew on a cotton roll and verify that there's no movement. Sometimes I'll even have the patient bite down on my finger on each side, just gently, just so that way I verify if there's any sort of micro motion that's occurring inside of here. Instructing the patient at this point with a LODI case, we want a light occlusion at this point. We also want the patient to be chewing soft food diet for approximately 2 to 4 weeks to allow for integration of the implants. If the patient is not satisfied with the retention here, then you could always switch to the blue inserts. However, I would really recommend straying away from that. I would either go with the red inserts or I would leave the patient with the black ones during the healing period. Either are perfectly fine. So other than that, this is a completed LODI pickup case using the new ZEST Chairside product. What's nice is that the Chairside comes with an 8-gram syringe, which is typically enough for 15 of the 2 implant pickup procedures, so approximately 7 patients for a 4-implant LODI case. You should be able to get out of a Chairside syringe. The ZEST pricing will also be available on the ZEST Anchors website, so feel free to go ahead and register on there to evaluate the pricing. But overall, I'm really satisfied with this product because number one, no primer is required. It's easy, it's simple, the handling characteristics are really amazing. It bonds to itself because of the shortened mixing tip and then also the ability to have this angled mixing tip. It's really easy to fill in voids, and at the same time you're reducing your cost per case because the less material that you use, the less expensive it is. It is dual cure, so we can accelerate the curing process as well as have a full set with a light cure, as opposed to some of the other products on the market that will tell you that you can accelerate the curing process. Merely what it's doing is applying heat to the polymerization reaction, where since this is based off of a composite resin type chemistry, the light cure will actually initiate polymerization a lot faster. It's odorless and tasteless. It has a low curing temperature, so ultimately your patients are more comfortable. And ultimately, it's a wonderful product that has been specifically designed for both locator and LODI cases, and I highly recommend it for you to evaluate. This is Dr. Michael Scheer with Learn LODI, a free resource for learning how to market, treatment plan, place, maintain locator overdenture implants. Thank you for tuning in. Stay tuned for next webinar coming up shortly. Have a good day. Bye-bye.